Well, good afternoon, everyone. We're going to go ahead and get started. I'd like to welcome you to the Cross-Sector Partnerships to Expand Options for Affordable, Accessible Housing Office Hours session. If we can go to the next slide. My name is Lori Gerhardt, and I work at the Administration for Community Living and lead the Office of Interagency Innovation. We work in partnership with the U.S. Department of Health and Human Services Assistant Secretary for Planning and Evaluation, we call them ASPE, A-S-P-E, the Center for Medicare and Medicaid Services, CMS, the Substance Abuse and Mental Health Services Administration, SAMHSA, also called SAMHSA, and the U.S. Department of Housing and Urban Development, HUD or HUD, to support the development of partnerships across the disability, aging, health, and housing sector to help people remain stably housed, help those that are experiencing homelessness obtain housing and the services they need, and help those living in institutions transition back to the community. As federal partners, we leverage our collective technical assistance resources through the Housing and Services Resource Center. Thank you for joining the Housing and Services Resource Center today for this third office hour session. Next slide. The session will feature partnerships between the housing sector and aging and disability networks. You'll hear firsthand from our speakers from Ohio regarding how they formed their partnership and learn how they are expanding options for older adults and people with disabilities to find housing and services to live in their communities. Next slide. Before we get started, we'd like to address a few housekeeping items. The meeting is being recorded. By staying to participate, you are consenting to the recording. Also, for audio quality, we're starting with all attendees in a listen-only mode. That means your microphone or phone is muted. But please know, we very much want to hear your questions and the strategies you may be using to develop partnerships. Please frequently use the chat to make comments and to ask the presenters questions at any time during the session. If it's a question for a presenter, please start your chat with question for and then enter the speaker's name. Or you may email a question or comment to hsrc@acl.hhs.gov. We reserve time during this session to address your questions. During the Q&A period, you may use the Zoom reactions function to raise your virtual hand, so we'll know who wants to raise a question and can call on you as time permits. You can also use the chat or email if you have a technical issue or comment for other attendees. Next slide. HHS and HUD recently launched the Housing and Services Resource Center. We're so proud of this opportunity. We've had over 10,000 people visit the website and thousands of people participate in our technical assistance activities. Next slide. We are working together to develop partnerships across the disability, aging, health, and housing sector to expand access to affordable, accessible housing, support people in finding and keeping their housing, provide access to services people choose that support independence and well-being. Next slide. These partnerships bring together housing, homelessness services, aging and disability services, health, physical, behavior, and mental health services, states, and communities. And we're all working together so people with disabilities and older adults can stay stably housed, healthy, and active and engaged in their communities. Next slide. Through the Housing and Services Resource Center, we provide coordinated technical assistance across the federal agencies for growing cross-sector partnerships at the state and community levels. We assist communities in leveraging new housing and services resources, including those from the American Rescue Plan. Our website at acl.gov/housing and services includes resources and tools that support learning and cross-sector action. We offer office hours and webinars, learning collaboratives, toolkits, and more. Next slide. And we're going to the next slide. Office hours are designed to showcase real-world examples of an activity taught by the people who are engaged in the activity. It's a time to learn how to get started, discuss methods that stakeholders from different sectors use, and receive practical tips. I like to say, peers teaching peers. It is also a time to share your strategies for developing partnerships with others. Next slide. We'll start this session with a short presentation followed by a long period for participants' questions and discussions that support peer-to-peer sharing. It gives me great pleasure to introduce our speakers for today's call. Justin Moore, who is the Vice President of Planning and Program Development at the Area Office on Aging of Northwestern Ohio. And then you'll hear from Ash Lemons, who is the Associate Director for the Ability Center of Greater Toledo, the Ability Center of Greater Toledo, a center for independent living. I'll turn things over to Justin to get us started. Justin?
Thanks so much, Lori. Welcome, everybody. Thank you so much for taking time out of your busy schedules to participate in this office hours session. This is a partnership. When I think of great partners, I think of the Ability Center. I think of our Center for Independent Living in Toledo as kind of that model partnership. The Ability Center and the Area Office on Aging really are all about making sure that people in our community thrive regardless of age, regardless of ability. And there's a lot of common ground and services that we focus on that we do better in serving the constituents we serve when we do it together. Next slide, please. This area of housing is one that has been a big focus for us for several decades now in the ways that our two agencies partner. And this slide just kind of illustrates why housing. We know that longevity and health a lot of times are determined not so much by what takes place by, with the person's genetics, or even with things like healthcare, what takes place within the four walls of a doctor's office or a hospital, but instead are really largely determined by what takes place in their home and their home environment and the behaviors in the home and the like. So we know that home is critical part of health as well as longevity. And both of those are goals for individuals with disabilities, regardless of age, individuals with who are at different places on the aging journey. So we know that this housing area is a critical piece. And on the next slide, we'll see why for us as an area agency on aging, housing is such an important focus area. For the vast majority of the individuals that we serve, housing is their biggest expense. And this is an area where many people really worry about the cost of healthcare because they know that they have housing that they're living in that is eating up a significant chunk of their fixed income in retirement. We also know that they're oftentimes dealing with increased transportation costs. When I first came across this statistic about transportation being the second expense in retirement, highest expense in retirement, it shocked me. I had not thought of transportation that way. And I think most individuals that are saving up kind of a retirement nest egg also are not planning for and saving up for a significant portion of their retirement expenses needing to be dedicated toward transportation. But when you think about it, if you're at a position where you need to hang up the keys because you've been in a lot of accidents recently and you feel like you might not be safe enough to drive anymore, or if driving at dark is tough and you have someplace you want to go at dark, paying for transportation can add up really quickly as a big expenditure. Next slide, please. So this just talks about unaffordable housing and how 1 out of every 4 older adults are living in housing that's unaffordable. So these are individuals who contact our agencies every day, and they're people who are really making those tough decisions between, paying for that new expensive prescription their doctor prescribed them, or paying their mortgage or their rent for the month. Increased utility costs also are a big factor and a big concern for many older adults. Having a grandchild, a knock on the door from the police saying that their grandchild is going to go in the foster care system because of something that happened with their biological mom or dad, and unless they move in with them, having those grandchildren move in with them as an additional mouth for them to feed that they hadn't planned on with their fixed income and the like. So there's all these kinds of scenarios that really put a strain and a lot of stress on older adults financially, emotionally, and the like. So finding a way to help individuals get more in the way of affordable, accessible, safe, and beautiful housing is a common area and common concern for both the Ability Center and the Area Office on Aging. Next slide, please. So when you take a look at that stat I just talked about before, 1 out of every 4 older adults are living in housing that's unaffordable. For our region in Northwest Ohio, that's about 40,000 older adults that are in unaffordable housing. Yet we only have 3,803 affordable housing units. So that gap between 40,000 older Northwest Ohioans that are living in unaffordable housing and the 3,800 housing subsidies that are available for affordable housing starts to speak to that unmet need for affordable, accessible, safe, and beautiful housing in our communities. Next slide, please. So with the Area Office on Aging, our CEO, Mrs. Billy Johnson, about 35 years ago, was really attuned to this and saw this unmet need for affordable housing, particularly in the rural parts of our area. So she worked on getting 3 housing subsidiary corporations built for affordable, accessible, safe, and as you see in these pictures, beautiful housing in those areas. And on the next slide, you'll see a couple more pictures of a couple more of those properties. And then also to help work with for-profit developers to really develop the campus that our headquarters is on, to include some safe, affordable, accessible, and beautiful housing here on our campus as well. And we do that not because we're looking to have a housing developer be our main hat that we wear as an area agency on aging, but instead because we know that with our agency having an active role in housing development, there's going to be more quantitatively and better qualitatively housing for older adults than there otherwise would be. Some of the housing on our campus, if you go to the next slide, please. There's a lot here on this campus. There's a Veterans Administration clinic right across the street from our office. Our office is in kind of the top right corner. But this whole campus is something that our CEO really helped develop. It includes the Site Center of Northwest Ohio right next to us for providing services for individuals with low or limited vision. There's a senior center on campus here. There's advanced specialty hospital, kind of a step down for individuals that might be on a ventilator and things like that. There's a Board of Developmental Disabilities on our campus. And a lot of affordable, accessible, safe, and housing, and that includes both housing for older adults as well as housing for individuals under the age of 60 with some disabilities. That includes veteran housing for individuals who permanent supportive housing for them. The post office right across the street. There's just a service-rich campus here. And housing-rich campus here. The Red Cross is also kind of catty corner from our campus. So a lot on this campus that's really been intentionally developed over the years. Next slide, please. And then the Area Office on Aging also is very attuned to the fact that fragmented care is not healthy for anyone, right? If have somebody that's just looking at somebody's long-term services and supports over here and somebody else's focus on their health care, that a lot of times stuff will fall through the cracks in those scenarios, and individuals will be told to contact the other kind of entity that's handling their health care, or the healthcare entity will tell them to contact the organization that's helping with their long-term services and supports, and just results in a really frustrating scenario for the individual that we're aiming to serve. So we've been working with 4 managed care plans to really take a comprehensive look at the needs of individuals, both from a long-term services and supports standpoint, as well as a healthcare standpoint. So these are 4 entities that we're working with. We're also helping individuals who are transitioning from hospital to home. So they're set up for success in coming home and not having to unnecessarily be readmitted to the hospital, or or being able to avoid an unnecessary discharge to a nursing home, but instead allowing people to move home where they want to be and be set up with the different services and supports so that they're set up for success at home. Next slide, please. So now I'll hand it off to Ash from the Ability Center for him to talk a little bit about some of the specific ways that we've had the pleasure of partnering with the Ability Center over the last several decades. Ash?
Thanks, Justin. That's a great segue. We're talking about nursing homes and nursing home transition. Back in 2011, we were transition coordinators for our Money Follows a Person grant, which we called Home Choice in Ohio. And early on, we recognized the barrier where, if you look in this picture, this gentleman's at his home and there's a ramp in the background, and he didn't get home right away. There was a barrier, and that was that the ramp wasn't there. And at one point in time in Ohio, if you were living in an institution and you needed a ramp on your home in the community, you weren't able to get funding to put that ramp on your home. So a lot of people were kind of stuck in the institution with no option. Well, an unsafe option, actually. So what we did is I reached out to Justin. We had a lot of folks on our list that had this barrier immediately. And we pulled some money together along with the Toledo Rotary, the Arios on Aging, and the Ability Center. We all pulled some money together and we bought 3 ramp systems, and we started moving people out of institutions back into their own home. That pilot project saw us be able to get 11 people out in the first year. In fact, the first lady that we were able to successfully get out of the institution and back home using this process, we got out the day before Thanksgiving, which was a great Thanksgiving for her and her family. So it became a model for the entire state for 10 years. And during those 10 years, we accumulated quite a few ramps, because once we got people out of the institution, once we got them their temporary ramp, we would look for funding. We would use our grants, our home mod grants, to get them a permanent project, or we would work with the Arios on Aging for them to access waiver in the community and put a permanent project on. We reclaimed those ramps when we could, and we've paid it forward. We've helped other people that were in similar situations where they were in a bind. And so far we've helped 153 people. So that really helps people be able to move back home and have choice and live in a community that they choose. Next slide, please. So another way in which we partner is home modifications. If you look at the bottom here, there's a lady. Our average age demographic is a 64-year-old single female with physical disability. And over the years, we've literally served thousands of people with home modifications. 60% of those have been people over the age of 60. So there's a lot of synergy between the cohorts that we serve. We've done so much business with our Arios on Aging that we've actually, just when you look at the Medicaid bids alone, we've done $1.4 million worth of business with them. And we've done additional projects with our grants for seniors. So that's a huge collaboration to accomplish that amount of work to help just in the 7-county to 10-county area that we serve together. So next slide, please. Another area in which we partner is we not only provide people with home modifications. When we do that, we also provide them with durable medical equipment. Again, here, our average person demographic of the person that we serve is a 66-year-old female single, a lot of times widowed, with a physical disability. The things that we typically provide as far as durable medical equipment are things that you find commonly in your bathroom, and they help prevent falls. So they're things that are often not covered by insurance as well. If you look to the left there, there's the top 5. I made it easy for everyone. If you wanted to start one of these programs, I can tell you what we did last year. We handed out just under 2,000 pieces of equipment. We served 783 people. And about 15% of those referrals came directly from the Area Office on Aging. And about half of the referrals came from a local hospital. The equipment that's often requested is for people to remain safe in the shower or to be able to do better self-care in the bathroom. As we know, that's kind of the common place where people have falls. I look at it as a fall prevention program. We're helping people remain safe in their homes and be able to do self-care, to be able to transfer, to be able to shower and remain independent in their homes. So you might ask, how do you fund this? Every state has a state designated assistive technology agency, and at the Ability Center, we have a grant through AT Ohio, which is housed with Ohio State University. And we work directly with them to serve people. We also run this program off of donations. So we have a lot of people that recognize that we have this program in the community. It's a great pay it forward when you no longer need it program. We bring the products in, we sanitize them, and we put them back in service. And we just continue to pay it forward year after year. Next slide, please. So if HAP stands for Home Accessibility Projects, this is just another pie chart showing the aging and disability connection. If we look at 1 year of our projects, you look at the pie chart on the left, 63% of the people that we served were over the age of 60. And that's been holding steady for as long as I've been with the Ability Center, which is nearly 20 years. Almost every year I run the statistic, and I kind of surprise our data people because I said it's probably going to be around 60%, and it always is. So there's a lot of synergy between people with disabilities and aging. And, you know, it's kind of a natural part of aging. What do we provide? Those home modification projects are typically ramps, stair lifts, common that people need when they want to remain in their home, but all their bathrooms and bedrooms are upstairs. We provide stair lifts, grab bars, and handrails. The pie chart on the right is basically showing you how we've kind of diversified that program. We have carpenters in-house. We've been able to control our quality by having carpenters staffed by us. We've been able to do a really good job with getting DME, durable medical equipment, to people while we're actually doing the home modifications. And if you see 42% of our business is coming from fee for service, that's coming from Area Office on Aging bids. Until we had that, you can see the other pie chart, on the pie chart, it says 47%. Those were grants. And you know, like, grants don't always come every year, right? Or you might run out of funding. This is a great way to keep carpenters busy. So partnering with your Area Office on Aging can help you provide better service to your entire community by kind of controlling quality and having better access to durable medical equipment and additional services. So it's kind of a bonus. Next slide, please. So this is the last slide I've got. So there's a lot of projects that we do that are applicable to aging and disability, but yet some of them aren't done in conjunction with the Area Office on Aging. Some of those are done solo. And I kind of box them into different things. You know, we've got educational based advocacy. On the right hand screen here, you see a book. That is a book that we actually produced about 5 years ago. And it really focuses in on the rights of people with disabilities to live in a community. So in that book, it was written by our staff attorney. We focused on Olmsted and the ADA, local advocacy, zoning restrictions. We get heavy into that so people know how to advocate when there's zoning restrictions that may prevent you from installing a ramp. We focus on reasonable accommodations as well, kind of goes hand in hand with zoning. And we focus on visitability and universal design in housing. And so that booklet, I can give you the link. If you Google the title and put Ability Center, it will show up. I should mention we also produced another book on transportation, and I have the link to that as well. And it's called Vital Connections, and it's all about rights of people with disabilities to inclusive, accessible transportation. So that's one way, is we educate. We create documents that help people understand what their rights are and how to access services. On that left-hand pane where you see the words housing, these are just a few things we did recently. We passed an ordinance in the city of Toledo. So you no longer can have people discriminating based on source of income. And you see I have, including Section 8 vouchers. If you're not working with your local housing authority, do so, because we recently were able to get 15 people approved for housing vouchers. And when we were doing the home choice program, we literally had like 50 or 60 people at any given time that were receiving vouchers. And so they've been a great partner too, and getting extra benefits so it's more affordable for people to live in the community. That's systems advocacy. And the bottom part that talks about accessibility reviews, and then here's we don't typically get involved in cases. We like to be proactive. We like to collaborate. This one, we tried that. It didn't work out for like 2 years. And so we finally had to pull out our gloves. But it had a good result. And basically the housing was multi-unit housing. And it was built with steps. And as most people know, multi-unit family complexes fall under Fair Housing Act. They're not supposed to have steps. It also follows the commercial code in Ohio. They're not supposed to have steps. So we engage with builders and developers, but we try to do so in a proactive way and provide information about universal design and building better so that all people can live in a community. Because like Justin said, the #1 issue that we run into is housing, affordability, and accessibility, and then in it being safe in a neighborhood of their choosing. And then the second, right behind it, which is ironic, we didn't look at each other's information before we had came up with these PowerPoints, but ours is transportation too, and it's kind of natural. We do share information with each other quite a bit, but housing and transportation remains the top barriers. And that's all I've got. And thank you for your time.
Thank you, Ash. I think I'll just share here one most recent way. I'll do a quick demo, and then we'll open up for questions because I saw some that came in the chat here, Ash, for you. So this is an area where both our agencies get a lot of calls is about what housing is available. I'm looking to move. I need a place to go. And a lot of times for, the first 15 or so years of my work here at the Arios on Aging, it was here's a list of all the different, places that you can contact. And, in Lucas County alone, where the city of Toledo is, that's 109 different places that were on that list. That's a lot of calling around for people. We know too that a lot of times when people call those organizations, the property manager might be part-time, might only be there some of the time. If they have turnover with a housing manager, the timeliness of getting a call back from those individuals might be a long time. And if they don't have any vacancies, they might not call the person back, unfortunately, at all. So the person's kind of left in limbo, wondering whether or not the housing is available. So what we did is we jointly funded putting together a housing search tool that people can either go online themselves and do, or they can call either of our agencies, and our agencies will have information referral specialists kind of verbally ask the questions of the individuals over the phone, and then plug in their responses, tell them verbally the kind of their housing best bets, or mail it to them, text it to them, email it to them, whatever they want. So I'm just going to say here with the example Ash gave of kind of their average consumer, let's say the person has a disability, they're age 64 years old, and we'll say that they're looking for, let's say their household income's in the 20,000 to 25,000 range, and that they're looking for housing in Toledo. They could specify a zip code if they wanted to. So there's 43 search results. Out of those 109, there 43 of those are a fit for that individual in that scenario. They can see real quick kind of snapshot what their estimated rent would be based on their household size, based on their household income range. They can see whether or not there's a deposit required, whether or not there's an application fee, how many bedrooms they have, whether or not there's a wait list, if so, what the average wait time is, if there's a pet, the pet's allowed or not. And what you'll see is I'll change here the income range from 20 to 25,000 to 25 to 30,000. And you'll see the number of results go from 43 to 35. You'll see that some of the rents adjust that are 30% of income. So instead of 625, I went to 750 for the estimated rent for that individual. And again, this allows us to print these results in a easier read format, allows us to create PDFs of them to be able to email or text individuals. So, and we did something similar in the area of transportation to make a really kind of one-click transportation search for individuals so they can get a sense of the estimated time for a certain transportation provider, the estimated cost for that specific trip, for that specific transportation provider, and the like. So this is just a highlight of some of the most recent ways that we've been partnering with the Ability Center. So now it looks like we have some questions for Ash that we probably want to get to.
Yeah, Ash, I see here there, Isaac Bean from Columbus says they have also have that source of income discrimination. I think there's a lot of interest in that, but they found it incredibly difficult to practically enforce that, especially from the outside. So I think there's interest in what strategies have you been using to ensure that landlords are complying with those ordinances?
So it was just recently passed. And what I would say is Katie Hunt Thomas is our staff attorney, and she's not with me right now, but I would love to get feedback from her on that and get back to you because I'm sure she's thought that through and had a strategy with her team. It could almost be an entire session, I would imagine. Katie knows a lot, and she's produced these 2 books. So I can get anyone that wants to, I can get her in touch or get kind of a generalized answer back to you guys.
Great. And I will vouch for that Katie does know quite a bit. But have you had any local movement on advocacy or policy for landlords who do not want to support home mods for their tenants?
Yeah. Interesting enough, when I first came up to the Ability Center to run our home modification program about 14 years ago, I noticed a pattern when I was processing the paperwork, and every now and then there would be people who would kind of not be interested in signing the paperwork to allow a tenant to get a home modification. And so I kind of just cited some of the Fair Housing Act right on our application, and gave the code reference, you know, so we had about 3 passages from the Fair Housing Act, a couple sentences long. I could share those with you guys, but from what I heard from people, the ones that looked at it said, I never knew this, but I'm glad you gave me the information, because I looked up the code citation and I educated myself, and I'll be glad to sign this paperwork.
Yeah. So, yeah, I think sharing Katie's information will be helpful too for Elizabeth Glantz and her questions around, you know, strategies as well. And I see there is a lot here about frustration with landlords, and sometimes even those landlords are family members. So Justin and Ash, how do you generate this database on affordable housing? Do housing providers submit their information, or do you data share with HUD?
Yeah, so I can start off addressing that one. Ash can add to the response. So there are other tools out there. There's a Go Section 8. There's a state-run database that is housing, and we really looked at those hard and said, you know, they all have some nice things about them, but they all have some significant, from our perspective, and handling calls, giving helpful information to callers. They all had some significant drawbacks. They all had this. They were all dependent on housing providers supplying, going out of their way and going on the website and updating their information, supplying information and the like. And so there's significant gaps, right? Those that did not supply any information. And then for those that did supply information, a lot of times it was outdated because they, you know, did it 3 years ago, and then go in there and update it when they no longer had a vacancy. Or there'd be the type of information that they feel comfortable giving out to people who call saying, how much rent will I pay when I move in? And so what we end up doing is taking even though it's more labor intensive, we jointly hired a housing navigator position that's kind of embedded in our Aging Disability Resource Network, that is a default person that's handling these housing calls, but also the default person that is, in many cases, cold calling all 190 of those properties just in Lucas County and trying to get all the information that's necessary for this. And where they're not getting responses for individuals, they are being a complete pest for that individual, you know, a thorn in their side until they do get a response. They're also looking at all different kinds of other information sources for that housing facility to be able to get the information. Sometimes, you know, contacting residents that we know and have served that live there to get information from them. But it would be not uncommon for some of the other types of systems and databases that are out there for the rent information to say the rent is from $0 to $1,200. Well, that's a huge range. You know, if I'm looking for a place that costs me $500 a month, I want to know, is it like 0, or is it 1,200, or is it like around 500? Is it something I can afford or not? So that housing navigator also took a deep dive into what kind of funding went into the building of that property to know what the sliding fee scale, if you will, of the rent is, and then to know what that would translate to. So for example, if the property is 30% of income because of the funding source that was used to build it, then we're able to do that math on the back end. The person says their income is, you know, $25,000. That results in $625 a month as kind of the worst case scenario rent for that individual. But then there's other sliding fee scales that, again, we kind of tag in the back end of that database so that when the individual chooses their household size, when they choose their income range, it does the math automatically for them on what that estimated kind of worst case scenario rent is for them. The other thing that it does is, if that property, let's say, only has 1 bedroom units in it, we have the assumption that only 2 heartbeats per bedroom. So if a person says that they're a household size of 3, when they click submit, it removes that property from the search result. That property that only has 1 bedroom units does not show up for them. So it really does provide a tailored and customized list that is helpful in that individual knowing kind of what their housing best bets are. We're also working, our photography consultants been going all across town, taking pictures of all these properties, both inside and some outside and some inside pictures, so that we can add those pictures to this housing list as well. They say that, you know, a picture's worth 1,000 words. If it saves the individual from having to go all around town to look at these places to see if they're a good fit for them, we're all for that, you know, saving trips, letting them, again, get a quick snapshot of whether or not this place might be a good fit for them.
Great. So I see Molly also put the link in there for anybody who's interested in going and exploring for themselves. It's just such a great tool that you have. Circling back a little bit, Justin, they're asking about Emily or Elizabeth Glantz is asking about strategies for the to get community interest and support for your campus, and what kind of funding streams were there with the veterans housing? Was VA funding part of it? So, you know, she notes that she's seen a lot of communities getting big pushback about affordable housing projects. I think we see that across the nation, and in her area, developers are able to pay a fee in lieu of including affordable units in apartment complexes. So can you talk a little more about that?
Yeah, that's a great question. It's one where there's lots of different possible options. Here on our campus, the Housing Authority provided some place-based vouchers to make those units affordable. There's also some HUD Section 202 properties, some tax credit properties. There's some also just private kind of market rate apartments here on campus. And you know, right now there's American Rescue Plan Act dollars that are in every community across the nation, that many of those communities are trying to figure out how to spend them. How affordable housing checks all the boxes on possible great ways that they could invest those dollars. Here in the city of Toledo, we just partnered with some housing developers to submit 3 affordable housing development projects to the city of Toledo. They're earmarking $16 million of their American Rescue Plan Act dollars for building 500 affordable housing units. So that's a significant dollar amount for the city of Toledo. That's 4 times what our normal affordable housing funding is that the city of Toledo procures. So this is really kind of a once in a generation opportunity to build affordable housing units in your community. Again, the county, the cities that have these funds, if they are not already looking to use some of their funds for that purpose, encourage you to contact your county commissioners, your mayor, your city council members and the like, and let them know that you want to see some of those dollars dedicated for affordable housing. And again, I think even if they have not procured those dollars yet, or maybe they have and you feel like it's too late, I would encourage you still to contact them, because the reality is those funds need to be used by September 30th, 2024. And there's going to be some projects that are more shovel ready than others. And for somebody that's not able to kind of follow through and meet that aggressive timeline, they might be looking for somebody else to step in and take that funding and take that place.
Yeah. So Ash, I see someone wants, Juliana wants some clarification about the home modifications, if they're available to renter households as well.
We have some of our own funding that we use for renters, and we've sought some funding through foundations, grants, our community development block grant funding, and our state Ohio Development Services Agency funding is, we actually have so many people that are qualified, we use all of it. And so and we got a pretty good award last time. It was $300,000. So we're going through a lot of funding in our area. That was over 2 years, but we had a lot of CDBG funding too. So we have no lack of qualified individuals with disabilities looking for home modifications that exhaust all of the funding. So we, in knowing that there's some people that are renting that need home mods, we've come up with some of our own funding. It's a smaller pot, but we've done it. Most of the time we're trying to help them relocate because a lot of times they're in a situation where it's not accessible or it's not affordable. And so this new relocation tool that Arios on Aging has, that they keep updated, it's been a good resource to go to.
That's great. I see how those two things work together then. I wanted to point out there are a lot of good resources here in the chat, including attorney Katie Hunt Thomas and the two booklets that Ash referenced earlier. So that's wonderful stuff. And also Justin put in the link to the transportation search, which, since housing and transportation are the major things, that's wonderful. And you know, I think Molly and Lori have added things about the assistive technology work. So we're kind of wondering if anybody else wants to talk about what's going on in their areas too, and how communities might be using the American Rescue Plan funding. So I know we would appreciate anybody raising their hand or putting in the chat information about what they're doing. But, you know, I think what you guys are doing is extraordinary, but maybe doesn't have to be extraordinary, because I think a lot of AAAs and SILs could be working together on these kind of projects. But I'm wondering if you can talk about a little bit about sort of the genesis of that. And I know both your agencies are longstanding in your communities, but I'm wondering too, like, what do you see about the commonalities among the older adults and the younger? What do you see as the main differences? And how do you kind of forge this kind of collaboration?
Ash, do you want to take that, or do you want me to?
You can start. I have a little to add, but if you want to start, that's fine.
Yeah, I think that both of our agencies have a strong desire to be person-centered, a strong desire to help individuals survive, you know, to thrive in the community setting, you know, to remain at home whenever possible and whenever it's safe for them to do so and the like. So I think those are real rallying points for both of our agencies, you know, where we can, you know, talk about different approaches to achieving those ends and the like. But at the end of the day, the calls that our agencies are receiving, there's a lot of similarities. You know, we're both getting a lot of calls about individuals who are looking for housing help. We get lots of calls from people that are looking for transportation help. You know, that's part of the reason why we are focusing on those two topics right now with these transportation searches and housing searches that are starting off in Lucas County, because that's where, at least for our agency, across our 10-county area, that's where 45% of the older adult population resides. But expanding that to our other counties as well. The whole adaptive equipment is another topic that we get lots of contacts about at both of our agencies. And, you know, we both have an advocacy focus. I would say from my experience that the advocacy focus at the Ability Center is, you know, extremely strong. But we also have, you know, roots and experience with advocacy at the Area Agency on Aging level as well. So I think that there's lots of areas where we can advocate both locally, state, and nationally together with a collective voice.
Yeah, we actually, I just have our information from the end of the year, all of our charts and data handy. And out of 4,100 calls that we received that we made into information referral calls, the number one was home modifications. So it's housing related. It represented almost 1,900 of those calls. Out of the 4,100 calls recorded, it represented 1,900 housing. Number two was assistive technology, durable medical equipment, came in around 1,100. And we have a dog program. We're kind of unique. That was the third one with 320. that's not typical. We have service and therapy dogs, and we're in 22 different schools, so that we're kind of unique there. So I'll skip that one. But advocacy is funny because Justin just named off 3 of our top 4. Advocacy is number 3 with 248 calls. The other thing, and around advocacy, like for transportation, when we have issues with people getting to the grocery store for food, or to getting to healthcare appointments, because they're not on public routes. And we've done a lot of advocacy together to get countywide transportation, and we were just able to get that probably this fall. I think it was this fall, Justin, that just passed. And really, I think it was Billy Johnson from your agency and Tim Harrington, our previous executive director, who really kind of spearheaded a lot of the work around how that even eventually got passed. So the credit to them.
Yeah, the thing I'll add to that is, there's our public transit authority quit holiday hours, quit weekend hours because of budget constraints going back several years, and our agencies took the lead together to call together all the different community stakeholders to get those restored. So, and piece together getting funding commitments from different agencies in a very creative way to get those services restored, which, definitely enhances the lives of both individuals of all abilities and individuals of all ages. The other thing I'll add is sometimes in Toledo, we had the biggest event in women's golf nationally came to Toledo, and we were focused on making that as user-friendly of a experience for people, regardless of ability, regardless of age. So that's just another way where we are making sure that these event planners and the like, and all the different considerations that you can think about are thought through from the perspective of somebody that's aging, or somebody with, might be in a wheelchair or walk, or whatever the case might be.
So I think it's really interesting to hear about your own iteration, but thanks to Lori Gerhardt, because ACL has done a lot about trying to, the whole work of the aging and disability community. And she did put a link in here about programs with aging and disability networks. So I think that's fascinating to kind of look at that around the country, and what area agencies on aging and SILs in particular are doing. So I don't know if we have other questions, but I think that it would be perfect timing if somebody wants to chime in with another question. Otherwise, we're going to turn this back over to Lori Gerhardt from ACL, who can kind of wrap up and help us with understanding where we go from here. I don't see another question, Lori, so.
All right. Well, thank you so much, Lark and Justin and Ash and all of you for those great questions. This has really been a fabulous session. We are going to start our wrap up, and we'd like to ask first that if you could please email us at hsrc@acl.hhs.gov and let us know how we can improve the next office hour session. We'd like to learn what you liked about the session and how you could use the information that you learned today to further develop and strengthen the partnerships that you have in the disability, aging, health, and housing sector. We had over 100 people register for today's office hours, which is really fabulous. And so we will be notifying all webinar registrants. And we also had a sign-up page for those that weren't able to register because we had reached our cap. So we'll be emailing everyone when the recording, slides, and transcripts are available on acl.gov. We'd like to ask, if you haven't already, to please sign up for ACL email updates. We'll be sharing information through ACL email updates around an array of information that really helps people, older adults and people with disabilities and caregivers, really live full lives in the community. I really want to take a moment now and just thank today's presenters, Justin Moore, Ash Lemons, and Lark Ritchie, for sharing this rich information on how they formed their partnership and showcasing their work. We want to thank our ASL interpreter, Sequoia, and our CART staff, Nicholas, for the great work they've done in helping to make today's session accessible. We especially want to thank the staff at the Housing and Services Resource Center, especially the team at US Aging and Mission Analytics, and the staff at the Administration for Community Living, and our federal partners at ASPE, CMS, SAMHSA, and HUD for the collective work to produce today's office hour session. And most importantly, we really want to thank each and every one of you for your attendance, your great questions, and your participation in today's office hour session. In closing, if you have suggestions on technical assistance topics, or you have a partnership across disability, aging, health, and housing organizations and have an innovative initiative you are doing to increase access to affordable, accessible housing and/or services, please tell us about it by emailing us at hsrc@acl.hhs.gov. We'd like to learn about your partnerships and the work you're doing together to increase housing stability, help those who are in institutions transition back to the community, and to help those that are homeless obtain housing and the services they are seeking to live full lives in the community. It's only by learning from all of you the activities that are going out there that we can really help strengthen all of our knowledge across the country on how we can better serve older adults and people with disabilities and caregivers to really increase housing stability and access to services. Thank you for the work you do each day to serve older adults, people with disabilities, their families, and caregivers, and have a wonderful day.